Hey, cheers, buddy.
Cheers. Hey, Dr. Otto Placik, the one and only. You got to take a sip. You got to take a sip, man. Come on.
I did already, but I beat you.
Today's episode, who is the plastic surgeon influencer? Who is the medical influencer, the provider influencer? Well, see, that's the thing. This one's really both of us together. I'll tell you, you influenced my creator career a lot. Because I remember asking you, how did these people let you post themselves on the internet?
That was the hardest thing, especially being in the Midwest, right? I mean, I grew up in California. Every waitress, waiter, any person you encounter is somebody to be an inspiring actor or actress. And so in the Midwest, people are conservative.
A little bit more.
And it took me a little while to build a clientele or patients that were willing to share their stories online. I posted one yesterday of a very attractive young female who, did she need breast implants? No, she wanted them. And I had a couple critical comments saying, hey, she's got a great body. Why are you doing this? Because the patient wanted it, and I can carry out a procedure with a low risk and achieve the look she wants.
It's so beautiful. I say this to everybody, like, nobody needs what we do. This is the most honest medicine there is.
But I think people don't understand that there's an added degree of pressure when there is no reason to cut.
We're taking beautiful people and cutting them open.
Right.
Like, I make this argument every day. The hardest surgery in the world is a purely aesthetic plastic surgery. I take beautiful people and I cut their face wide open. Everybody's going to see the scar. So, like, that's a lot of pressure.
I remember the very first procedure I did as a student. And I was fortunate to have a mentor who allowed me to operate as a second-year medical student. I was following him for a long time. It was a diabetic with an abscess, foot abscess, right? And it was...
That's like a big infection that needs to be drained. I mean, it's nasty. And it's got to be treated.
If it proceeds, they can lose their leg. You have to drain it. You have to treat with antibiotics. And you're fighting this primal instinct. You're taking a knife and you're putting it into a person's flesh. And literally, I feel like someone psychologically is holding my hand, like, don't do it. But if I do it, I'll cure them. And you do it. You release the pus. The person feels a relief.
Immediately better, by the way.
Immediately better, right. And does anybody care about the scar? No. But when you go to do a facelift or a breast augmentation, if you don't make it, and complications occur, I wish they didn't, we try our best. We want to be heroes.
We've talked about this before. We obsess about it more than most patients. And I think that's what makes a good surgeon, particularly a good plastic surgeon, is when you really care about the results. The stress on surgeons, I think, is much higher than people really appreciate.
On plastic surgeons.
On plastic surgeons, yeah. Cheers to that.
I mean, my dad's a cardiologist. My stepfather was an endocrinologist. They did life-saving work, arguably better than what I do. But we change people's lives. I'm not trying to brag. We change people's lives. I'm humbled by it. And when people write me letters and send me gifts for something they've already paid me for, and I am so humbled that they trust me, to take care of them. And that's like the greatest honor.
This could be a whole, like, people on in the comment section, I'm sure they'll come out. Maybe people shouldn't be, cutting themselves, to change their bodies, but it really makes people happy. And the fact that it makes people happy, I mean, it's not our fault, right? Like, if you want
to deny that is denying basic existence.
And listen, I until recently, I used to do a lot of trauma at the county, and I have literally spent 12 hours doing a trauma case, mess, got to get car wreck, got shot, whatever. And then at the end of the case, the guy said, F you. He's mad at me. And it's like, damn, man. So, and I'm tired, I missed my kid's recital, whatever. Then you spend an hour and a half making a jawline look hotter, and they send me flowers, they give me a watch. It's like, don't hate the player, hate the game. I always say that. The fact that and it is true, I've had plenty of patients like yourself say, you changed my life.
I questioned, I wanted to be a cardiac surgeon, a neurosurgeon in medical school. And I thought about plastic surgery. Again, my dad being a cardiologist. And I remember hanging out with the cardiac surgery team, and these surgeons did these incredible surgeries, saved these people's lives, and the people were complaining about the scar across their chest. And then we went with the plastic surgery rotation, and people were glowing. They had paid to be cut upon, and they were ecstatic and crying. Tears of joy. Yeah. And that had so much a driving force on me confirming that I want to pursue that career.
Okay, I want to get back to your creator career because it's really about the creative component of it. And Instagram's your kind of platform of choice, I would say.
It's evolved.
Yeah.
When he was in diapers, to start on Musical.ly, you probably don't even know what that is. That was the precursor to TikTok. And I dabbled in a bunch of different venues and social media. And I tried things, and I had like 3 channels canceled on Musical.ly. So then what happened is I went to Snapchat. Now, Snapchat was pretty good because they were ahead of the game.
And you can be the lines are a little bit blurred about what you can do.
A lot more blurred.
Yeah.
I mean, I would show a breast
Snapchat,
covered
right?
and musically canceled me.
Yeah.
And I had to change my username 3 times.
Yeah.
You know, Placik 1, Placik 2, Dr. Placik. And eventually I think I progressed to YouTube.
Yeah, you have pretty good YouTube.
I did initially, way back when.
YouTube's.
But then YouTube changed the reimburse. I never wanted to be reimbursed. I just want to put information out there. But then they restrict, you know, your viewers. Then I went to Snapchat, and Snapchat was it for me because one of my unique practices is female genital plastic, and that's the last taboo of showing, you know, surgery. I was able to accumulate quite a large number of viewers on Snapchat and show a lot more. There were a couple instances where I was, you know, censored.
And by the way, showing this, like, just lets more people know that there's an option. I mean, some of this stuff, particularly the genital surgery, is just like pain involved. I mean, these are things that I kind of joke that insurance should pay for them. Like me I have a whole population of polycystic ovarian syndrome, which causes this like atypical fat distribution in the face. And I'm like, really, insurance should pay for this. Or genital surgery when they have pain or discomfort or whatever.
What about otoplasty?
Yeah.
When I was... Again, when he was in diapers, I was doing otoplasties at Children's Memorial Hospital, and it was covered by insurance because kids were called Dumbo. They were socially isolated. No, I mean, most of my patients are not getting otoplasty covered.
I wouldn't think so anymore.
And because it's not covered by insurance, people don't have it done. But what happens, I've had an 80-year-old woman come to me and say that my parents would let me have it. I couldn't afford it when I was a teenager. My husband, who married me, said he wouldn't. He passed. I've got the money, and I want to do it now.
Yeah.
80 years old.
That is so powerful. That's like that should be powerful. A case report. Should be a case report.
Literally, to me, I said to her, "Why now?
Yeah.
And why not anything else?" She was an adorable person. This is, you know, it's
beautiful.
It goes back to nip and tuck. Why are you here? What's your complaint? And we don't mean complaint in a bad way. It's like, what are you seeking in improvement? Right. What bothers you? And she said, my ears. They've bothered me all my life, and I was just fascinated.
Yeah.
But yesterday, I was preparing for this list, and I got a call on Instagram from a doctor I've never met.
I get those.
But he knew me from Instagram. It was a patient of mine that moved to Florida, and she has an issue that I have sent her to arguably the best for that specific area. And this physician, it was nice through social media, through the creator space.
Yeah.
He felt that he knew me. I really didn't know him, but we instantly bonded last night. And I was talking to him at 10 o'clock at night, and that was 11 o'clock because he was in Florida, trying to figure out the best solution for this patient who had moved there. And I said, I wish I could offer her a better solution. I did what I thought was in my best interest. Yeah. And again, primum non nocere. First of all, do no harm. I didn't want to do anything excessive that I thought would place her at excess risk. And he kind of felt the same. And it just was like a brotherhood that social media, the creator space, has allowed me to extend. And I think I've really made friendships. For you, I've met directly, but there are people who I might not have contacted with in the traditional practice that have allowed me to, contact people in Europe. When I've given a lecture in France,
it's like this connectedness,
and they feel they know you, and you do kind of know them. And then it's colleagues, it's friends, it's neighbors, and it's future patients.
I would say, personally, like I just did my numbers. 61% of my patients fly in, and I operate them on the same day. It's bizarro. So, and most of them say, I feel like I know you. And so that's how I've really utilized this social space. I think.
And on top of it is we have different personalities, and I think we're a little more outgoing.
We're probably closer than a lot of people,
But I think that if somebody really doesn't like me, they don't come to me. And that's so wonderful because I think
I tell the patients it's a relationship. You don't need this. You're paying me to do this. You're going to see me a lot. If I do a face-off on somebody, I probably see them 30, 40 times post-op. So I was like, if you don't like me and I don't like you, this is going to suck. And I don't want this scenario either. Let's stick to the creator stage. So your Instagram kind of whatever journey
morphed. So that was after Snapchat.
And because Instagram, don't you think that a large proportion of your patients find you somehow through social media?
60%.
60, right?
60.
So that's a lot. And you don't pay a lot of money for Instagram. Like maybe boost a post here and there. But
I get up in the morning probably 45 minutes to an hour earlier than I otherwise would do. And before I know it, it's a rabbit hole. I am
looking at stuff,
scrolling
editing,
at stuff, editing, and what's trending. What's new?
Hold on, this gets me to this. So when I do these, I've studied these different creators, from Bella Porch to Tiffany Moon to Mr. Beast, and I've kind of created these 3 classifications. One being the people that just get lucky, go viral. That's the Bella Porch. Very cute, funny, did a great video, got hundreds of millions. Genetic, beautiful person, yeah. 2 would be like the grinder, the person who just like hammers it every day. And then 3 would be the like purely outlier. Hyper intelligent, hyper beautiful. So I think the Bella Porch really more was lucky, right? She's pretty, but she's not outstandingly beautiful. I think that really outliers are like Tiffany Moon. That woman, she went to Cornell at 16. So she finished high school early, she finished college early, she finished med school early. Like she was done with med school residency, everything by 22. So she's like hyper intelligent. You can't compete with that. Those people are lucky. The first one you can't compete with. The ones you can compete with, where I think we both would fall, are in the middle of the pack, number 2, like a grinder.
100%.
Yeah.
We as plastic surgeons are considered the lowest medical
it's the hardest
relevance factor. They don't want, you talk about
round faces, chubby cheeks. They don't like it. Yeah. I mean, this really gets into the politics of it, like algorithm driven beauty standards that are now. So listen, there's always been the issue, right? Way back in the 1910s when you were still doing surgery.
I was going to say this.
There was always like the models who were like maybe a little airbrushed. So there's always this aspect of it, okay? But it was normally a human who was altered. There's some predictions that by 2030, there's not going to be any real human as a model. Even in maybe that's what this actor strike was about. The movies are going to be AI.
Voices,
everything's going to be fake. I had a patient bring me their photo, and she's like, I want this. And I was like, okay, who is this? She's like, oh, it's me. I was like, oh, okay. So, and her jawline was a little more narrow. Okay, I can help with that. Cheeks were a little more narrow. We can help with that. And her eyeballs were bigger. The sclera of her eye, it made the volume of her eyeball bigger. So I was like, listen. And
Disney knows that.
Yeah. Oh, look at every Disney princess.
They're always big eye.
Yeah.
And that's the.
So these apps do it. So now these are going to be people and it'll be really subtle. Right now, if you have a keen eye, you can look at an image and say, I think that's AI. But I'm telling you, weeks, months, maybe a year, we're not going to be able to tell. So Elgar Beauty, I'm defining the word right now. The 2 of us, pay attention. I'm telling you, it's going to be a thing. And this is what it is algorithm-driven beauty standards that are non-human that become adapted by humans. And I'll tell you a couple things. One, as a plastic surgeon, they're never happy, right? Because I can't make them a cartoon. So I get them I'm like, holy smokes, this is going to go on a billboard. And they're like, well, but I wanted more of this. I'm like, dude, that's not real. You can't get that. 2, I think it's forcing a lot of these young people. You have 2 daughters. I have 2 daughters and a son.
3.
You have 3 daughters?
Yeah.
They're going to grow up in this and they're never going to be satisfied. And I see it in the young people.
Satisfied is such a technically complicated word, right? Because this is true among all human desires. Algor beauty is nothing different than any other sense or drive, right?
Yeah.
Now, sex is the number 1 seller. What's the second most important thing is hunger, right? So right now, we're at a critical time where science, industry knows what drives our appetites, salt, fat content, and people are undertaking unhealthy diets. And industry is promoting foods that they know the public will buy because they know the salt and fat content and everything drives them to it. Now, what is it? Algor beauty is like people want a specific hip to waist ratio.
Yeah.
They want that eye separation. There's a certain drive that makes us respond. Now, is it healthy? Not for diet.
That's the onslaught of like the BBL world, right?
Right.
They're taking the fat from here, putting it here. I mean, it's so unnatural.
Yes and no, but there is a certain drive that makes people want that. Now, is it influencers like J-Lo and then Kim K? All of them have created an illusion, albeit with, filters.
I operated on a patient who he was making a very good salary. And his sole job, he worked for this A-list celebrity, was to make sure no photo got out of her without it being edited, without him seeing it, editing it, and then re-releasing it.
I will tell you even more. One of the nurses I work with, her son is a paparazzi, and he would get a tickle call that a certain K family would show up at the beach because they knew he would publish only favorable photos of them.
Yeah.
And I'm going to be at Malibu Beach at 1 p.m. in my bikini. And he would snap 1,000
and maybe
photos.
edit it a little bit. Maybe bring the hip in slightly. Make the belly button look a little smoother. Yeah.
Right. And you know what?
Yeah.
He makes money for those photos because he sells those photos.
He makes money, but think about how much money they make by making the photos look good. So we're talking hundreds of, thousands, millions. I mean, it's
people respond. I look at Kylie's pictures and go like, oh my God, she is.
Okay, and see, this is exactly, but now, the Elgar Beauty key to this, now we're getting inorganic, non-human things driving this. So at least these are based on one of the Kardashians tweaking themselves. Now it's everything coming completely algorithm fake driven.
It's never changed. Do you even know who Mae West is? No.
This is like an old
She was this amazing, pre-Marilyn Monroe, had this amazing beauty. It was clearly with corsets. She had this abnormal whalebone, contouring her waistline. So, waistlines were abnormally created to a hip to waist ratio back in the 30s, 40s, 50s. And then what happened? And then, airbrushing. And then you get to the generation of, and I always say like—
I'm having like flashbacks right now.
Angelina Jolie, right? We all know she's got 1,000 tattoos. Do you ever see those in movies? Yeah. No, they've been airbrushed out. Playboy, airbrushed. And so Elgar Beauty is just a new variation of a theme.
It is. That's good point. But I do think it's exponentially different. Now it's a machine creating this. So it is similar to the corset. It is similar to the airbrushing, but it's like corset, airbrushing, AI-driven standards to people. So now our brains just aren't made to work like that. So that's my concern with it.
We as scientists and physicians have to have what we call disclosure, right? If we go to our colleagues at a meeting, we have to disclose if we have any financial incentive, whether we've been paid by a company. The one issue I have is that if somebody's going to use a filter, fine, but disclose that the filter is being used.
Amen.
It's true. Cheers.
Amen, yeah. Please, let us know.
So that is the one issue I have with Instagram or any of these social media channels. Is like, you should disclose if you used a filter.
Zuckerberg, why not? Give me one answer. Advice for yourself at age 30 when you're growing your practice. Like, what do you think? I mean, it's a hard one. I still don't have an answer for me.
I think the number one advice to myself is be your genuine self. Like, I want patients who want to want me. And I want patients who I want to want them. Yeah. And if I'm too cavalier, if I'm too short, if I'm offensive, and I've lost patients. They're right. And I think he and I connect with patients in a different way than 85% of most surgeons do. I think that we have a certain connection where we have a genuosity.
It's a relationship, really. And I think it's the truth. Like, if you really care about the outcome, the patient, I mean, we do. Like you said, we want to get paid for what we do. This is our job, but it becomes your whole persona. So I want people to see me on the street and be like, Dr. C, oh my God, good to see you. And when it goes wrong, I'm like, dude, I'm going to do everything I can to make it right. I promise you. Like, and it's the honest truth. I mean, I have no other mean in my life.
Colleagues I've met who are from Libya, who are like, oh my God, this patient's like texting me at 3 a.m. and she's upset that I didn't respond in like 30 seconds. Yeah. And it's like, wow. We want to be heroes.
Yeah,
we want to, but we are humans. We have families. We have responsibilities. We have to sleep. We have to wake up. We are all patients. And I think genuine or sincere doctors know that, and we want to deliver the best of our abilities.
The key is, I think that intense dedication to perfection is the only thing you can have if you're going to get into this field. Because and there's so many things involved in perfection. 1, making people look good. 2, getting people satisfied. 3, making the outcomes good. Like, there's so many things. Obviously, being safe. Obviously, don't do any harm. Like, those are given. Those are like, I'm not even considering that when I make a decision. That's given. All right, everybody. Thank you. To summarize, this is who is the creator, who is the plastic surgeon, who is the medical creator, influencer, whatever. I think this is a dive into the world of us. And I have one more question. Plastic surgery or aesthetic medicine, whatever, in 200 years. Is it more prevalent, less prevalent? So let's say 500 years.
It's human nature to want to be better.
It's going to keep going, right?
I can't even begin to perceive what the genetic modifications are.
So there's going to be a genetic cyst who makes you hotter.
Right.
Who modifies your genes.
Modifies your pheromones. You know, like
That's easier.
what you emit.
That's easier, by the way, than actually cutting somebody. Modifying the genes is easier than, I think, cutting a face.
I believe it is. Okay.
All right, we're signing out.
Cheers.
Cameras off. We don't want to get canceled. We're going to turn the cameras off now. Revolution Brewery, thank you for sponsoring this episode.
Tito's, Austin, Texas.
Thank you for sponsoring this episode retroactively. We appreciate it. Send your money to Content Club Chicago on Milwaukee Ave. Cheers.